Why does headache pain only affect certain areas? Imagine feeling a sharp pain in just your forehead or a dull ache behind your eyes. Why does headache pain stay in some spots and not others? The answer lies in how our nerves are wired in the head and neck. The main nerves involved are the trigeminal nerve and the upper cervical nerves. The trigeminal nerve is the largest cranial nerve and is responsible for sensation in most of the face, the front of the head, and the sides. It has 3 branches, one for the forehead and eyes, one for the cheeks and upper jaw, and one for the lower jaw and part of the ear. When this nerve is activated, pain is felt in the areas it supplies, like the forehead, temples, or around the eyes. The upper cervical nerves come from the top 3 neck vertebrae, called the first, second, and third cervical vertebrae. These nerves provide sensation to the back of the head and the upper neck. When these nerves are irritated or inflamed, pain is often felt at the back of the head, called the occipital region. Sometimes, this pain can radiate to the front of the head or behind the eyes. There is a region in the brainstem called the trigeminocervical complex. It is where sensory signals from both the trigeminal nerve and the upper cervical nerves meet and are processed. Because of this convergence, pain from the neck can be perceived as a headache, and vice versa. That is why neck problems can cause headaches, and headaches can sometimes feel like they start in the neck. Different types of headaches tend to affect specific areas because of which nerves are involved. Migraines often cause pain in the front and sides of the head because of trigeminal nerve activation. Cervicogenic headaches, which come from the neck, usually cause pain at the back of the head and may spread forward. Cluster headaches are usually felt deep behind one, reflecting the involvement of the ophthalmic branch of the trigeminal nerve. Knowing which nerves are involved helps doctors figure out what kind of headache someone has. It also guides treatment options. For example, physical therapy for neck-related headaches targets the upper cervical spine, while migraine medications often work on the nerve pathways of the trigeminal nerve. So, the reason headache pain only affects certain areas is because of the specific nerves that carry pain signals to different parts of the head and neck. The way these nerves are organized explains why pain shows up in particular spots and helps us better understand how to treat them.